Are you curious about Azopt and its uses? In this video, we will delve into the main conditions that Azopt addresses, dosing information, side effects, and even user opinions. Whether you're a healthcare professional or a patient seeking information, we've got you covered. Azopt, a prescription medication, is commonly prescribed for managing high intraocular pressure (IOP) in patients with ocular conditions like open-angle glaucoma or ocular hypertension. It belongs to a class of drugs known as carbonic anhydrase inhibitors, which work by reducing the production of fluid in the eye, thereby lowering IOP. Our expert research will provide you with the most up-to-date and accurate information about Azopt's recommended dosing, potential side effects, and how real users have found it to be effective in their treatment journey. We understand the importance of having reliable information at your fingertips, so join us as we explore the ins and outs of Azopt and its diverse applications. Main conditions addressed by Azopt. Azopt is primarily used for the management of high intraocular pressure, IOP, in patients with certain ocular conditions. The main conditions that Azopt addresses are open-angle glaucoma and ocular hypertension. Open-angle glaucoma is a chronic eye condition characterized by damage to the optic nerve, often caused by increased fluid pressure in the eye. Ocular hypertension, on the other hand, refers to elevated IOP without any signs of optic nerve damage or vision loss. Azopt helps lower IOP in both of these conditions, reducing the risk of further damage to the optic nerve and preserving vision. In addition to these primary conditions, Azopt may also be prescribed for other ocular conditions, such as secondary glaucoma or pseudoexfoliation glaucoma. Secondary glaucoma occurs as a result of another underlying eye condition or injury, while pseudoexfoliation glaucoma is characterized by the buildup of tiny protein fibers in the eye's drainage system, leading to increased IOP. Your healthcare provider will determine whether Azopt is suitable for your specific condition and individual needs. Azopt is available in the form of eye drops, making it convenient to administer and allowing for direct application to the affected area. It is important to follow your healthcare provider's instructions on how to properly use Azopt to ensure optimal results and minimize the risk of side effects. Understanding the dosing information for Azopt. The recommended dose of Azopt for most patients is 1 drop in the affected eyes 3 times daily. It is important to adhere to the prescribed dosing schedule and not exceed the recommended dose, as this can increase the risk of side effects without providing additional benefits. Before using Azopt, make sure to wash your hands thoroughly to maintain proper hygiene. Tilt your head back slightly and pull down your lower eyelid to create a small pocket. Gently squeeze the bottle to release a drop into the pocket, being careful not to touch the tip of the bottle to your eye or any other surface. Close your eyes for a few moments to allow the medication to spread evenly across the eye. If you are using Azopt in both eyes, repeat the process for the other eye. If you are using other eye drops or medications, it is important to wait at least 10 minutes between administering Azopt and any other eye drops to prevent interactions and ensure proper absorption of the medication. If you have any questions or concerns about the dosing instructions, do not hesitate to consult your healthcare provider or pharmacist for clarification. Common side effects of Azopt. Like any medication, Azopt may cause side effects in some individuals. The most common side effects reported by users include blurred vision, burning or stinging sensation in the eye, dry eyes, foreign body sensation, itching or redness of the eye, and bitter taste in the mouth. These side effects are usually mild and temporary, resolving on their own without the need for intervention. However, if these side effects persist or worsen, it is important to inform your healthcare provider. In rare cases, Azopt may cause more severe side effects that require immediate medical attention. These include eye pain, eye discharge, eye swelling, eye redness, changes in vision, or an allergic reaction characterized by rash, itching, swelling, severe dizziness, or difficulty breathing. If you experience any of these symptoms, seek medical help right away. It is worth noting that individual responses to medications can vary, and not all users will experience side effects. Some individuals may tolerate Azopt very well and not experience any noticeable side effects. However, it is important to be aware of the potential side effects and report any unusual or concerning symptoms to your healthcare provider. User opinions and experiences with Azopt. User opinions and experiences can provide valuable insights into the effectiveness and tolerability of a medication. While individual experiences may vary, many users have reported positive outcomes with Azopt in managing their ocular conditions. Some users have noted a significant reduction in intraocular pressure and improved vision after starting Azopt. They have expressed satisfaction with the convenience of using eye drops and the ease of incorporating them into their daily routine. Users have also appreciated the minimal side effects associated with Azopt, with most reporting only mild and transient discomfort upon administration. However, it is important to remember that every individual's experience with medication can be different. What works well for one person may not have the same effect on another. It is always advisable to consult with your healthcare provider to determine the most suitable treatment approach for your specific condition. Alternatives to Azopt for similar conditions. While Azopt is an effective medication for managing high intraocular pressure, there are alternative treatment options available for individuals who may not tolerate or respond well to Azopt. Some common alternatives to Azopt include other carbonic anhydrase inhibitors like dorzolamide, Trusopt, or bronzolamide, Azopt suspension, beta blockers such as timolol, timoptic, prostaglandin analogs like latanoprost, Xalatan, or alpha-adrenergic agonists such as apriclonidine, iopidine. The choice of alternative medication depends on various factors, including the individual's medical history, current medications, overall health, and the specific ocular condition being treated. Your healthcare provider will assess your unique circumstances and recommend the most appropriate alternative treatment option if needed. Precautions and warnings when using Azopt. Before starting Azopt, it is important to inform your healthcare provider about any existing medical conditions, allergies, or medications you are currently taking. This will help ensure that Azopt is safe and suitable for your individual needs. Some precautions and warnings associated with Azopt include avoiding its use if you are allergic to any of its ingredients, as severe allergic reactions can occur. It is also important to exercise caution if you have kidney or liver disease, as Azopt can affect these organs. Pregnant or breastfeeding individuals should consult their healthcare provider before using Azopt, as the medication may potentially harm the fetus or pass into breast milk. Additionally, Azopt may interact with certain medications, such as oral carbonic anhydrase inhibitors, leading to an increased risk of side effects. It is crucial to inform your healthcare provider about all the medications you are taking, including over-the-counter drugs, vitamins, and herbal supplements, to avoid any potential drug interactions. How to get Azopt and cost considerations. Azopt is a prescription medication, which means it can only be obtained with a valid prescription from a healthcare provider. If you believe Azopt may be beneficial for your ocular condition, schedule an appointment with your eye care specialist or general practitioner to discuss your symptoms and determine the appropriate treatment plan. As for cost considerations, the price of Azopt can vary depending on various factors, including your location, insurance coverage, and the pharmacy you choose. It is advisable to check with your insurance provider or local pharmacies to inquire about the availability and cost of Azopt in your area. If Azopt is not covered by your insurance or if you are experiencing financial difficulties, you may be eligible for patient assistance programs or other cost-saving options. Pharmaceutical manufacturers often provide assistance programs to help eligible individuals access their medications at reduced or no cost. Consult your healthcare provider or conduct online research to explore potential financial assistance options. Azopt in combination with other medications. In some cases, your healthcare provider may prescribe Azopt in combination with other medications to achieve optimal control of intraocular pressure. Combining medications with different mechanisms of action can provide a synergistic effect, enhancing the overall effectiveness of treatment. However, it is crucial to follow your healthcare provider's instructions and adhere to the prescribed dosing schedule when using multiple medications simultaneously. Be sure to inform your healthcare provider about all the medications you are taking to avoid any potential interactions or adverse effects. Conclusion and final thoughts. Azopt is a prescription medication commonly used for managing high intraocular pressure in patients with ocular conditions like open-angle glaucoma or ocular hypertension. It belongs to a class of drugs known as carbonic anhydrase inhibitors and works by reducing fluid production in the eye, thereby lowering intraocular pressure. Understanding the main conditions Azopt addresses, dosing information, potential side effects, and user opinions can help individuals make informed decisions about their ocular health. It is important to consult with a healthcare provider to determine the most appropriate treatment approach based on individual needs and circumstances. While Azopt is effective for many individuals, alternative treatment options are available for those who may not tolerate or respond well to Azopt. Precautions and warnings should be considered, and potential drug interactions should be discussed with a healthcare provider. If Azopt is recommended for your ocular condition, ensure that you follow the prescribed dosing instructions and report any unusual or concerning symptoms to your healthcare provider. Regular eye examinations and ongoing communication with your healthcare provider are crucial for monitoring the effectiveness of treatment and making any necessary adjustments. Remember, this video is for informational purposes only and should not replace professional medical advice. If you have any concerns or questions about your ocular health or the use of Azopt, consult with a qualified healthcare professional.